The question some people ask is, what are my expectations of an aesthetic result and what's the recovery like? So when we look at expectations, that is finalized during the initial consultation. We want, what do you want your nose to look like afterwards? There is a really pretty narrow range what most people like. I have a 30-year experience doing rhinoplasties. I've invented with some colleagues 2 different procedures for the nose surgically that people currently use. So having that background helps. When we're doing the consultation, we go over the aspects of both the nasal tip, the end result, and the nasal dorsum, and putting those together. If we decide to do adjuvant therapy, such as lip augmentation with either filler or an implant, or a chin implant, all that gives harmonious result to the face and gives the best aesthetic results. So what the expectations that you're gonna have, we discuss preoperatively. The ones that take the longest to get better are classically related to the nasal tip. The dorsum, within usually several months, gets the results that you want. The nasal tip can take 1 to 2 years for all the edema and swelling to get better to show the best results. The key is that we have enough structural support to your nose that your nose doesn't collapse or alter its general appearance. If it does, then potentially revision surgery is needed. Everyone has different strengths to their cartilage. Sometimes we need to do a cartilage graft, sometimes we don't. We discuss that in person. When I'm in the operating room, I use my expertise to decide, do we need that or not? So the expectation is, are we gonna do ear cartilage grafting or nasal septoplasty to get cartilage? That is discussed during the initial consultation, and I use my best expertise with my experience in the operating room to determine, do we need to do cartilage grafting? Recovery. The advantage of rhinoplasty is a minimally uncomfortable procedure. 1 or 2 days of taking pain medication is all that the average patient does. In terms of bleeding or drainage from the nose, 1 or 2 days at the outside, 3 days of having a little bloody drainage. We have a cast aqua splint. We heat it up, mold it to your nose, and we have some steri strips, which are like Band-Aids, and that's designed to squeeze any blood out of between the skin and the underlying cartilage and bone to get the best results possible. The more that's in there, the more you're likely to get scar tissue and not get the best result that you're looking for. So the cast is removed at 5 to 7 days. Any sutures from an open rhinoplasty here are removed at 5 to 7 days. Inside your nose, you have sutures that absorb on their own. So we usually recommend using antibiotic ointment on a Q-tip or your finger 3 or 4 times a day. 1, it coats the incision so it feels better. You get less crusting and uncomfortableness. Usually you can breathe from your nose immediately after surgery. If we take cartilage from your nasal septum, you might have a little bit of nasal obstruction for a couple of days before that resolves. So recovery is quick, within 1 week. Most people have no pain. The swelling is significantly improved. If they bruise, it's usually to a minimal degree. Only about 5% of patients have any significant bruising. So we want you to get the best results. And the way we do that is get your input beforehand and listen to our recommendations in terms of post-op care to get the best result you're looking for.